common exercises that people end up getting hurt and end up coming to see me for shoulder pain, very common is push-ups. A lot of people end up doing push-ups, and as they do more and more push-ups, sometimes just the overuse of the push-ups can cause some injury to the shoulder. Another very common thing I see is people bench pressing as they increase the weight and they go for personal records. A lot of times that can put a strain on the shoulder and cause a shoulder issue or a shoulder problem. And then many times people that are doing either pull-ups or dips, also as they kind of get to a fatigue state, they get tired and they can also hurt their shoulder in those instances also. I think most people end up hurting themselves when they're going for personal best or trying to push themselves past the point where they're really fatigued. It really comes down to form. You want to make sure you keep a good form during the entire repetition, especially when you get tired. So when you're on your third, fourth, fifth set, you really want to focus on good form and don't sacrifice form to complete the exercise. That's when people get hurt. I think you want to make sure you're not increasing your weight too quickly to the point that you want to have just like everything we do in life, kind of slow and steady wins the race. So as you increase your weights, you want to do it kind of systematically over a set amount of time. A lot of people try to do it over too short a period, and that's when injuries occur. The most common injury I see, especially in my kind of probably 25 to 45-year-old age range, when people are kind of exceed the weight or they have an overuse injury, is when they end up injuring kind of where the bicep attaches in the shoulder. Something we've talked about previously called a slap tear, which just stands for superior labrum anterior posterior. It just describes where the bicep attaches into the shoulder, and you can get a small tear where the bicep attaches in the shoulder, which is really painful doing repetitive weight activities, especially any type of weight activities where the weights are away from the body. So when people have a slap tear, they either have a lot of pain kind of in the front of the shoulder, or sometimes they have pain in the back of the shoulder. And sometimes it kind of rotates between the two, which confuses people because it doesn't always feel the same. Smart things to do, obviously stop the exercise that you're doing. You want to do the standard kind of RICE. So rest, ice, take some anti-inflammatories. And if in 3 to 4 or 5 days it doesn't get better, I would definitely come in, see us so we can kind of give you a proper workup. 80% of the time we can get you back to the gym, back to doing what you want without any type of surgery. So I would say don't wait. Sometimes the longer you wait, the harder it is to get you back to 100%.